Well, today we have a very valuable panel, and I have heard some of these panelists at Talk Shop and at other events, some of the breakfast with Best Times breakfast. They are very knowledgeable at what they do, and they know what is right on the pulse of what people need when they are faced with caring for a loved one, whether that be an aging loved one or whether that be a loved one who's handicapped. They really do know what's going on. So we've got a couple of questions for each of our panelists. And let me introduce our panelists first, and then we will jump in. Today, we have Tom Lannon, who is representing Mid-South Home Helpers. That's Lou Novak. And Thomas Lannon is going to be sharing some information about the non-medical assistance in the home or non-medical assistance for your loved one. We have attorney Chris M. Knudsen. She's a certified senior advisor, elder law, paralegal, and aging consultant with the Bailey Law Firm, is on our panel today. Thank you, Chris. We have Kathy Armstrong and Denise Ward of Baptist Home Health Care and Hospice today. They're going to be obviously talking about home health care as well as the hospice service that can go along with that. We also have Greg and Kelly Inman of Next Day Access. They make the stair lifts, the wheelchair access, and those kind of things. They can make it available to your loved one the very next day. Greg and Kelly Inman, we appreciate you being on the panel. David Hodges with Boatwright Pharmacy. Is David here today at all? If you are, unmute yourself and say hello. Okay, so did I miss anybody on our panelists? Kathy Armstrong, Denise, Greg and Kelly, Thomas Lannon, Chris Knudsen. Okay. Well, we're going to start out. Let me find Chris. Let's see, Chris. There we go. There we go. All right, so you are our first panelist, and I appreciate you on the Talk Shop Health Care panel today. This is Chris Knudsen, certified senior advisor, elder law, paralegal, aging consultant. You guys do elder law, Medicaid eligibility strategies, VA aid and attendance qualification, conservatorships, trust, personal care agreements, estate planning, and probate.
That's right.
Here's two questions. First question number one. What is the difference, Chris, between estate planning and elder law?
Okay, so it's kind of summed up. We like to sum it up in a few words. And estate planning is what happens if I die. Elder law focuses more on what happens if I live. How am I going to pay for that? What options are available for me? How do I make the most of what I already have as far as financially? What are my options for home care? The focus of this group, kind of making home care possible. What are my options there? So the difference between estate planning and elder law is kind of summed up that way. Elder law is what happens if I live and how am I going to support myself?
All right, very good. Number two question for you, Chris. If I have a will, does that mean that my family will not have to go through probate?
Okay, yeah, this is a question that every time I speak for senior groups, as a certified senior advisor, I get the privilege of speaking to senior groups who think, well, if I have a last will and testament and I've already designated everyone to get my estate and what I have, then I don't go to probate. And the truth is, the last will and testament is a document for probate. So you need to, if you're planning on passing your estate on to your loved ones and you want to avoid probate, you do need to sit down with an attorney and look at elder law or estate planning and look at what you have, who you intend to get it, and how you can make beneficiary designations in order to avoid probate. But if you own things that don't have beneficiaries on them, or payable on death, or within a trust, then you are going to have to use a last will and testament in order to move those assets to your loved ones.
Very good. And now if you guys have a question right now, can you put it in the chat box and just put it out to everyone, but address it to Chris Knudsen with Bailey Law Firm, and we'll try to circle back around and answer your question. And if we do run out of time today, Chris, I will be emailing you the chat log, and if you could reach out to that person.
Sure.
And please, if you are just joining us, go to your chat box icon, click on that, put your name, your company name, your contact information, and what product or service that you offer, so that we are able to get hold of you after Talk Shop and build some relationships. Thank you, Chris.
Thank you.
With the Bailey Law Firm. Now we're going to go to, let me see, I've got my gallery view on here. Let's see, let's go to Greg and Kelly Inman with Next Day Access. And Greg and Kelly are in the home modification business. You guys do safe ambulation and access to the home, physical home modifications, accessories, equipment available to reduce all risk for that client, plus increased access and independence. Next Day Access. Our first question to you guys, Greg and Kelly Inman, is does Next Day Access file insurance?
Well, that's actually a great question. It's not so much do we take insurance. It's really that a lot of our products, the ramps, grab bars, stair lifts, things like that, are not covered by your general health insurance or even Medicare, Medicaid, things like that. So a lot of what we do is private pay. But saying that, we have finance options available, and so we have plans that could help, because I know it's a tough time. Usually when they get around to us, the event's already happened. If they have a stroke, heart attack, accident, whatever it may be, the event's happening. If they're aging in place, of course, they have time to plan for it and talk about it. But we know it's an expensive time, so we have plans available to help out.
Very good. And question number 2 to our panelists, Greg and Kelly Inman of Next Day Access. Do you have rental options, or all of your products permanent long-term?
That's actually one of the plans that we have. We rent a lot of what we also sell. So if you have a short-term need, there's no need to purchase. If you have a short-term need, we can rent for 1 month. We can rent for 3 months, 6 months. It doesn't matter. It's all open-ended. We don't lock you in for a 1-year rental plan, anything like that. So yes, we do rent mainly our wheelchair ramps and our stair lifts and scooters, and even lift chairs or recliners that help you stand up and sit back down without struggling too much. But yes, so to answer your question, we do rent, and you can also rent to own. So if you rent it, decide 6 months or a year down the road you want to keep it, then you didn't lose all your rental money. A lot of it can go towards the purchase of it.
I was going to interject real quick. We also have a showroom if you guys are interested in coming by. We are right behind St. Francis in Bartlett. It's 3150 Stage Post Drive, Suite 103. It's by appointment right now, but we can certainly meet you there. We have a variety of durable medical equipment, and
we just ask that you wear a trash bag over your body if you come by to see.
Very good. Well, you guys be thinking of some more questions for Greg and Kelly Inman when we circle back around. Right now, we are going to go to, and let me find Kathy Armstrong. Kathy Armstrong with Baptist Trinity Home Health. And Kathy, I've got a couple of questions for you.
Okay.
And let's see, where are they? Let's see. Hold on just a second. Here we go. Does my insurance pay for this service? And how long do I receive services? Before you answer, though, let me just recap. Kathy Armstrong is with Baptist Trinity Home Healthcare, personal in-home skilled nursing, occupational, speech and physical therapies, medical, social work, and nutritional consulting. She is with Baptist Trinity Home Health. Kathy, so the question again, does my insurance pay for this service, and for how long do I receive these services?
Okay, so yeah, so again, what first happens for getting a home health referral is we have to get it from a physician in order to go out to anybody's home. And in the home there then too can be their physical home, assisted living, independent living place. So we have, you know, wherever that patient is living, we can go into their homes. And so it's dictated, you know, each patient we see is different because of their needs. So when our field staff go in, they determine the length of, you know, how long they're going to be there, how many visits are going to be, you know, given to that patient based on their needs. So again, there's, you know, we have like a 60-day period where we say we can go in, but that can also be extended again, depending on if they've, you know, reached the maximum potential. And if they haven't, then we can get additional orders to go on. And again, yeah, Medicare does pay for all this. So never, you know, is there a copay? Our staff doesn't go in asking for any kind of copays or money. This is all being billed through the insurance, which the our patients that we're seeing don't have to worry about. They don't have to, you know, do any of that filing of that. And like we said, we have nursing, physical therapy, occupational therapy, speech, home health aid, social work services. And sometimes people get all those, or they just get, you know, a few. So it just, again, depends on what that doctor sees those patients' needs are for.
Very good. Kathy Armstrong. And since we are already on your screen there, we're going to go to Denise Ward.
Good morning.
Good morning. And Denise, it's good to see you again. Denise was on Real Estate Mortgage Shop a while back talking about hospice. Denise does palliative care and hospice, pain and symptom management, emotional and spiritual support, counseling and bereavement support, patient and family caregiver education, Baptist home health care, and hospice. Denise Ward, what are the two most common questions that are asked of you when it comes to hospice and palliative care?
I think the first thing, just like everybody wonders, is the cost. What is it going to cost me? And Medicare usually covers this cost, and normally your insurance does, whether it's a commercial or Medicare, it is covered. You don't, even if it's a supplemental, it reverts back to traditional Medicare. So it is a service that is covered by Medicare that you've paid into every month. So by all means, go on and take advantage of that. Most people wish they had really enrolled in hospice earlier because of the services it gives and the comfort it gives to not only the patient, but the family. It gives them support. We build a care plan specific to that patient's needs. And I would say right now in this epidemic that's going on, it's important that we keep our loved ones who have chronic diseases at home and not having to go to the emergency room and things like that. So we want to do everything we can to keep them home. And that's why this may be a service that may definitely benefit them. And another big question is, people are like, once I get into hospice, do I have to stay in there? You can come off of hospice if for whatever reason it does not meet your needs, or you decide that you don't want the service anymore. The only criteria is that you have a chronic disease. We do require a referral from a physician, but you have to have a chronic disease, which is stated by Medicare.
Very good. That's Denise Ward of Baptist Trinity Hospice. And I don't believe David Hodges is on the panel today, unless, if you are, unmute yourself, David, and we'll come to you. But we've talked to Thomas Lannon of Mid-South Home Helpers. We've talked with Chris Knudsen with the Bailey Law Firm. We've talked with Kathy Armstrong with Baptist Trinity Home Health, Denise Ward of Baptist Trinity Hospice, and we've talked with Greg and Kelly Inman of Next Day Access. So at this point, if there are any questions, if you can unmute yourself and go ahead and ask your question, and anybody on our panel are welcome to answer. So go ahead if there's anybody.
Joe, do you have any questions for me at home health care, at home helpers?
Let's see, actually, I did want to say something about you guys. You guys have been on Real Estate Mortgage Shop and have helped some of our listeners. And I just want to say that you get thumbs up from them. They've called me back and said, hey, thank you for connecting me. Love the service. You guys always, you talk about when you are interviewing your caregivers, you can determine whether that person has the caregiving gene or not. And you really do
You too.
motivate people who help that have the caregiver gene. Can you talk about, Thomas, real quick, can you talk about some of your guidelines that you use when you are choosing a caregiver and when you are going on the job?
Sure, Joe, I'd be happy to. I think that after spending a few decades in the advertising business, understand that people tend to trust companies who advertise a lot on television. And there are a lot of people in the home care business that do advertise on television, and that's great. But you know, the difference is, what is the difference with these companies? And that is basically how the local company is managed. And part of that, to answer your question, is how they recruit and vet potential caregivers. So how many years experience do you require? You know, do we do a nationwide criminal check? Do you do drug testing? Do you vet every one of their referral sources that they give you? And are you very thorough in how you interview and how you hire your people? So there is a difference. And as you mentioned, you know, you call it the caregiver gene.
Yeah.
You know, some people really choose to do this as a career, as I have and as Mary Lou has, to really help people. So that is a difference. You know, just like any other business, how you recruit and how you hire, because the people who we put in your living room or in your assisted or independent living room with your loved ones is the real difference from company to company.
Very good. Anybody have any questions for Chris Knudsen with the Bailey Law Firm, Greg and Kelly Inman of Next Day Access, or Kathy Armstrong and Denise Ward of Baptist Trinity Home Health and Hospice? Just unmute yourself and go ahead and ask away. Okay, I do have a question though for Chris Knudsen. Chris, if you're still out there.
I'm here.
To ask a question about trust. When you put, like if you have an aging loved one that's going into a nursing home or assisted living and you want to put their assets into a trust, what is the look back period? In other words, if something happened and your loved one passed away, would those assets in that trust still be, I mean, could the state still come after those assets after they pass away? And what's the look back period?
Okay, well, that's it's a twofold question. There is a look back period for both Medicaid and veterans benefits. I want to clarify, I'm actually not an attorney. I'm an elder law paralegal and a certified advisor. So and this is not legal advice, of course, but there is a 3-year look back now as of last October of 18. There's a 3-year look back for veterans benefit asset transfers. It's not quite that simple, but pretty much 3 years now, looking back, kind of the same idea as Medicaid. Medicaid is a 5-year look back. So yes, you can transfer wealth from your loved one's bank accounts, liquid assets, into an irrevocable asset protection trust. And those assets then are protected, but you have to wait through a 5-year look back period for Medicaid and a 3-year look back period for VA. And normally the penalty period, financial penalty for not waiting is definitely greater than the assets that you've protected. So the look back is important. It's even more important now to plan ahead. It used to be that we could transfer wealth for VA, especially where there's an at-home spouse for both VA and Medicaid, and protect wealth and then go ahead and apply for benefits. That's just not the case anymore. You have to plan ahead.
Very good. Very good answer to that. Does anybody have any other questions for Chris Knudsen with the Bailey Law Firm? Just unmute your, put your cursor over your video frame and click unmute if you have a question.
While they formulate, I had a private question that I think stands an answer as well. I had a private question saying, how are we handling meeting with clients and signing documents? And I'm really pleased to say that we did some drive-through, literally outside drive-through signings where people stay in their car. These documents can't wait. We sign documents and they just drive on through. Governor Lee signed an executive order on Friday now allowing remote signings. So whether it be Zoom or FaceTime, there's some rules that we have to follow, but we have several signings coming up in the next 2 days with Zoom conferencing where we can see our client, and then you have a certain amount of days to get everything signed by the notary and witnesses. But we're moving forward. So there's no reason to not move forward with your documents.
Okay. All right.
Hey,
I want to
Chris,
go ahead.
Yeah, I have a question. Probably it's related to the look back period. What happens during the look back period? Sorry, I'm very new to it. So I wanted to understand what happens during the look back period.
Well, during the look back period, there should be, if you have used a professional to handle asset transfer, like an elder law attorney who's qualified, the idea is you only do asset transfer if you can justify having enough asset to get you through the look back period. It would be a bad idea to transfer wealth for someone to protect it when their health is already obviously going to require that they could possibly need skilled nursing, or spending enough money on care between now and when the look back period is over. There's some strategy there to decide, is this a good strategy? Do we have enough money? God forbid this goes south quickly. We don't want to transfer wealth and incur a look back penalty because you are private pay. During the look back penalty, you get to pay for your care. Once that look back period is over, then you apply for the benefits that you were protecting assets in order to get. Does that make sense?
Yeah. Yes. Thank you.
Very good. I believe that Miranda Griffin has a question for Greg and Kelly.
Yeah, I just want to, I know you guys do a lot of different products, and for a lot of the visitors that are on here, can you just share some of your top products that you have for your clients, but also maybe a product that most people wouldn't think to have in their home that would be helpful for their loved ones?
Thanks, Miranda. Yes, we, of course, our most important products are wheelchair ramps. They're actually aluminum wheelchair ramps. We do not build wooden ramps. They go together like puzzles, which we basically just take the different sections. We do an evaluation at your home to see what you need. Just take the pieces back and build it right there in your front yard, your carport, wherever it needs to go. But a lot of people don't realize that that's even available. I hear people all the time, I go into their homes and they'll say, I didn't even know y'all existed, because they could have used that ramp 5 years ago or something like that. So the wheelchair ramps are probably the biggest unknown that people don't realize, that the people that are struggling right now just to get up and down 2 or 3 steps, they don't realize there's an easy solution out there. So that's probably the biggest thing. But also, we've all seen the stair lifts that go up and down the stairs, seen commercials on TV. They've been in a few movies. I think Gremlins was one where somebody went up the stairs real fast or something. But we actually put those in on a very regular basis, probably 1 or 2 a week. We install those. So wheelchair ramps, grab bars, and stair lifts are probably our biggest products. But we also can do bathroom modifications if you need a roll-in shower. We do other kind of modifications. We also install home elevators as well as other lifts, vertical platform lifts. I can give you all the technical names, but they'll probably just be a blur. And so if it has the word lift in it, if you need to get from this level to this level, then we can help you. That's probably the best way to put it.
I want to go back really quickly to Kathy. And Kathy Armstrong, did we answer the question about what is your company doing regarding COVID-19 and keeping your patients safe? Did we answer that? You got to unmute yourself. You got to unmute yourself there. Let's see if I can find you here.
Okay.
There.
Can you hear me now?
Yes.
Okay. Yes. No, we didn't. And I was going to make sure we got back to that because of this being so important right now. So just so everyone knows, we are taking patients or, that do have the virus. So what our field staff is doing though too is that, doing the precautionary measures by they're having their temperatures taken on a daily basis before they, when they come into the office and in people's homes. They are wearing the PPE, equipment, the face mask, the N95 mask, their gloves, changing that out. And another thing that they're doing that we've put into the homes is a visitor log. So that way, not only do we know that our staff is coming in there, but also that anybody else in the home, so they can, know and keep track of who's coming in and out. One of the things I see there was a question on here that asked about, are you seeing assisted living facilities refuse your services because of the COVID-19? Yes, we are. We're seeing it there. We're seeing it in the homes. But again, what we're asking is that, maybe we're not going in as often. Let us come in once a week as opposed to 2 or 3 times a week. They're making the video calls. So it has, some facilities are being very strict. And again, we're just doing our best to try to just limit the visits and get in and do what we can, or at least with, the video chatting to those places and even in homes.
Mm-hmm. Very good. I'm that. Anybody have another question for Kathy or Denise?
Joe?
Yes. Yes.
This piggybacks on what Chris was talking about when parents give their children a home. And there's some insurance implications there. Whoever's name the house is titled in has to carry the insurance. And sometimes this gets overlooked. And another scenario is mother has son living with her, mother passes away, son continues to pay the insurance policy under his mother's name. That is not right. He is a new customer for the insurance company. And when a parent passes away, it is very wise for the children to contact the agent. There may be vacant house rules that the insurance company has. Now, most insurance companies, if a customer passes away mid-policy year, the policy stays in effect to the end of that year. But there needs to be a conversation between the child and the insurance company.
That is excellent. Excellent. Real quick, I just want to go back to Thomas Lannon, and let me find you, Thomas. Hang on. I will find you. I will find you. Here you are. Okay, so Thomas Lannon, I know that we see a lot of I know that we see a lot of care facilities advertised in the media. And how do they differ from Mid-South Home Helpers, and how do they differ?
Well, as I mentioned earlier, there is a difference. Actually, since you asked it, I could speak about the industry. There's different ways to vet potential caregivers. In the case of home helpers, we're actually a very difficult agency to work for because we're very stringent upon national criminal background checks, for example, when many people just do a tri-state area. We require so many years of experience. And the other thing too to keep in mind as you shop for options for someone to care for loved ones is how those are priced. The industry tends to price by the hour. The ranges are somewhere between $18 to $25 an hour. Most times it's a 4-hour minimum, all the way to 24/7, which we do have some people that we care for all day and all night. And you can tell a little bit about how much they charge as to what they're paying their caregivers. Obviously, people on the lower end of that scale are probably paying minimum wage, and that's reflective of the nature of and the kind of caregivers that they can recruit and keep, versus people like home helpers who doesn't spend money on TV advertising, but pays our caregivers a little bit more. So those are the kind of economies of scale that you may not consider because most people who have to go through this process are doing it for the first time and don't really know how to go about it, is a little bit of common sense, a little bit of if you're charging less, you're paying less. But you know, we really do look for those people who have that carekeeper gene, and that really is a difference in how people run their local business, despite, you know, the national TV advertising, which is wonderful and it's good and it gives people name awareness, but you know, it's not really that important when it comes right down to who's in the living room with mom.
Right, very good. Well, anybody have any other questions? If you have a question, please unmute yourself and ask before we go to the next segment of our program.
I have a question for Denise.
Who's talking?
This is Tom Landon.
Oh, okay, Tom.
I have a question for Denise
Okay.
about hospice care.
Okay. Can you hear
I
me?
wanted you to be able to tell us a little bit more about, is the hospice care traditionally provided in a facility? Is it traditionally provided at home? Are there options for both? How does that fit people's needs?
Okay. Can you hear me?
Yes.
Okay. I couldn't see. Okay. That's a great question. We do home hospice. We do hospice in facilities, and I know we've addressed kind of anywhere your patient or your loved one is, we can do hospice, whether it's at home. We have assisted living facilities. We have the nursing homes. We also have the hospice house out in Collierville behind Baptist Collierville Hospital. That is a lovely facility if, for whatever reason, your loved one does not want to be, you don't want your loved one at home, and you would like them to be at the hospice house. So regardless of where your loved one is, we will do services and help you get through that journey together. And then we continue to stay with the caregiver even after that, 13 months later, just for bereavement, to make sure that they're doing okay.
Very
Did